Discover the various uses, benefits, side effects, dosage, and risks associated with diazepam, a widely prescribed medication. Diazepam, commonly known by its brand name Valium, is a versatile drug with multiple applications. This video will delve into the different ways diazepam is used to provide relief and improve the quality of life for individuals facing various health conditions. As a benzodiazepine, diazepam acts by modifying the chemical activity in the brain, inducing a calming effect. It is commonly prescribed to alleviate anxiety disorders, muscle spasms, and seizures. Patients suffering from insomnia and alcohol withdrawal symptoms may also find relief with diazepam. While diazepam offers several benefits, it is essential to understand the potential side effects associated with its use. These may include drowsiness, dizziness, and impaired coordination. Additionally, diazepam carries some risks, including dependency and withdrawal symptoms if used over a prolonged period. Knowing the appropriate dosage and using diazepam responsibly is crucial for optimizing its therapeutic effects while minimizing potential risks. In this comprehensive guide, we will explore the different aspects of diazepam, enabling you to make informed decisions about its usage for your specific needs. Uses of diazepam. Diazepam has a wide range of uses in the field of medicine. Its primary uses include the treatment of anxiety disorders, muscle spasms, seizures, insomnia, and alcohol withdrawal symptoms. Let's take a closer look at each of these uses. Anxiety disorders. Diazepam is commonly prescribed to individuals suffering from anxiety disorders such as generalized anxiety disorder, GAD, panic disorder, and social anxiety disorder. It works by enhancing the effects of a neurotransmitter called gamma-aminobutyric acid, GABA, in the brain, which helps to reduce anxiety and promote relaxation. Muscle spasms. Diazepam is effective in relieving muscle spasms caused by conditions such as cerebral palsy, spinal cord injuries, and multiple sclerosis. By acting on the central nervous system, diazepam helps to relax the muscles and provide relief from spasms, allowing individuals to regain mobility and improve their quality of life. Seizures. Diazepam is often used as an emergency medication to stop prolonged or recurrent seizures, also known as status epilepticus. It can be administered orally, intravenously, or rectally, depending on the severity of the seizure. Diazepam works by suppressing abnormal electrical activity in the brain, preventing further seizures and potentially saving lives. Insomnia. Diazepam is sometimes prescribed to individuals struggling with insomnia, a sleep disorder characterized by difficulty falling asleep or staying asleep. It helps to induce sleep by promoting relaxation and reducing anxiety. However, due to the potential for dependency and other side effects, diazepam is generally recommended for short-term use in cases of severe insomnia. Alcohol withdrawal symptoms. Diazepam is used in the management of alcohol withdrawal symptoms, which can occur when individuals abruptly stop or reduce their alcohol consumption after prolonged periods of heavy drinking. Diazepam helps to alleviate symptoms such as anxiety, tremors, and seizures, allowing individuals to safely detoxify from alcohol under medical supervision. In addition to these primary uses, diazepam may also be prescribed for other conditions such as muscle spasms associated with tetanus, restless leg syndrome, and as a preoperative sedative. Benefits of diazepam. Diazepam offers several benefits for individuals facing the aforementioned health conditions. Let's explore some of the key advantages of using diazepam. Anxiety relief. One of the primary benefits of diazepam is its ability to provide relief from anxiety. By enhancing the effects of GABA, diazepam helps to calm the mind, reduce excessive worrying, and promote a sense of relaxation. This can significantly improve the quality of life for individuals suffering from anxiety disorders, allowing them to better cope with daily challenges. Muscle relaxation. For individuals experiencing muscle spasms or stiffness, diazepam can provide much-needed relief. By acting on the central nervous system, diazepam helps to relax the muscles, reduce pain, and improve mobility. This can have a profound impact on the overall well-being of individuals with conditions such as cerebral palsy, spinal cord injuries, or multiple sclerosis. Seizure control. Diazepam is a vital medication for managing seizures, particularly in emergency situations. By suppressing abnormal electrical activity in the brain, diazepam can help to stop prolonged or recurring seizures, preventing potential complications and reducing the risk of brain damage. This can be life-saving for individuals with epilepsy or those prone to seizures. Sleep induction. Diazepam can be an effective short-term solution for individuals struggling with severe insomnia. By promoting relaxation and reducing anxiety, diazepam helps to induce sleep, allowing individuals to get the rest they need. However, it is important to note that diazepam should only be used for short periods due to the risk of dependency and other side effects. Alcohol withdrawal support. For individuals undergoing alcohol withdrawal, diazepam can provide much-needed support by alleviating withdrawal symptoms. By reducing anxiety, tremors, and seizures, diazepam helps individuals safely detoxify from alcohol under medical supervision, increasing the chances of a successful recovery. The benefits of diazepam can significantly improve the quality of life for individuals facing various health conditions. However, it is important to weigh these benefits against the potential risks and side effects associated with its use. Common side effects of diazepam. Like any medication, diazepam can cause certain side effects. It is crucial to be aware of these potential side effects to make informed decisions about its usage. Common side effects of diazepam may include drowsiness. One of the most common side effects of diazepam is drowsiness. This can affect the individual's ability to carry out daily activities, drive, or operate machinery. It is important to avoid activities that require alertness until the drowsiness subsides. Dizziness. Diazepam can cause dizziness, which may increase the risk of falls or accidents. It is important to take precautions when getting up from a lying or sitting position, especially if experiencing dizziness. Impaired coordination. Diazepam can impair coordination and motor skills, making tasks that require precise movements or balance more challenging. It is important to avoid activities that could be dangerous if coordination is compromised. Memory problems. Diazepam can cause temporary memory problems, especially at higher doses. Individuals may experience difficulties with short-term memory or have gaps in their memory during the time they are taking diazepam. Dependency and withdrawal symptoms. Diazepam can lead to dependency if used over a prolonged period. Abruptly stopping diazepam or reducing the dosage without medical supervision can result in withdrawal symptoms, such as anxiety, irritability, insomnia, and rebound anxiety. It is essential to discuss any concerns or potential side effects with a healthcare professional before starting diazepam. They can provide guidance on how to minimize side effects and monitor the medication's effectiveness. Dosage guidelines for diazepam. The appropriate dosage of diazepam varies depending on the individual's age, weight, medical condition, and response to the medication. It is crucial to follow the prescribed dosage and consult a healthcare professional for guidance. The dosage guidelines for diazepam may include anxiety disorders. The typical starting dosage for anxiety disorders is 210 mg taken orally, 2-4 times a day. The dosage may be adjusted based on the individual's response to the medication. Muscle spasms. The initial dosage for muscle spasms is typically 210 mg taken orally, 3-4 times a day. The dosage may be adjusted based on the severity of the spasms and the individual's response. Seizures. The dosage for seizures varies depending on the type and severity of the seizure. It can be administered orally, intravenously, or rectally. In cases of status epilepticus, an initial intravenous dose of 5-10 mg may be given, followed by additional doses if necessary. Insomnia. Diazepam is generally prescribed for short-term use in cases of severe insomnia. The recommended dosage is typically 210 mg taken orally, before bedtime. It is important to use diazepam for the shortest duration possible to minimize the risk of dependency. Alcohol withdrawal symptoms. The dosage for alcohol withdrawal symptoms is typically 10 mg taken orally, 3-4 times a day during the first 24 hours. The dosage may be gradually tapered down over time to minimize the risk of withdrawal symptoms. It is crucial to strictly adhere to the prescribed dosage and follow any instructions provided by the healthcare professional. Modifying the dosage without medical supervision can lead to adverse effects or reduced effectiveness of the medication. Potential risks and precautions of diazepam. While diazepam can be highly beneficial for individuals facing certain health conditions, it is essential to be aware of the potential risks and take necessary precautions. Some of the risks and precautions associated with diazepam usage include dependency and withdrawal. Diazepam can lead to dependency if used over a prolonged period. Abruptly stopping diazepam or reducing the dosage without medical supervision can result in withdrawal symptoms, such as anxiety, irritability, insomnia, and rebound anxiety. It is important to follow the prescribed dosage and consult a healthcare professional for guidance on tapering off the medication. Risk of overdose. Taking higher doses of diazepam than prescribed or combining it with other substances that depress the central nervous system, such as alcohol, can increase the risk of overdose. Overdose symptoms may include extreme drowsiness, confusion, slowed breathing, and loss of consciousness. In case of an overdose, seek immediate medical attention. Pregnancy and breastfeeding. Diazepam can potentially harm the fetus during pregnancy and may pass into breast milk, posing risks to breastfeeding infants. It is important to discuss the potential risks and benefits with a healthcare professional if you are pregnant or breastfeeding. Interactions with other medications. Diazepam can interact with other medications, including certain antidepressants, anticonvulsants, and pain medications. These interactions can increase the risk of side effects or reduce the effectiveness of either medication. It is crucial to inform healthcare professionals about all medications, including over-the-counter drugs and supplements, before starting diazepam. Impaired cognitive function. Diazepam can impair cognitive function, including memory, attention, and reaction times. It is important to avoid activities that require mental alertness, such as driving or operating machinery, until the effects of diazepam are known. It is important to discuss any pre-existing medical conditions, allergies, or concerns with a healthcare professional before starting diazepam. They can provide personalized guidance, monitor your progress, and address any potential risks or precautions specific to your situation. Alternatives to diazepam. While diazepam can be effective for various health conditions, there may be situations where alternatives are preferred or more suitable. Some alternatives to diazepam may include cognitive behavioral therapy, CBT. For individuals with anxiety disorders, cognitive behavioral therapy can be an alternative or complementary treatment. CBT focuses on identifying and changing negative thought patterns and behaviors that contribute to anxiety. It can provide long-lasting benefits without the potential side effects associated with medication. Physical therapy. For individuals experiencing muscle spasms or stiffness, physical therapy can be an alternative or adjunct treatment. Physical therapists can provide exercises, stretches, and techniques to improve muscle function, reduce pain, and enhance mobility. Anticonvulsant medications. In cases of seizures, anticonvulsant medications such as lamotrigine or levetiracetam may be prescribed as alternatives or additional medications to diazepam. These medications are specifically designed to prevent seizures and can provide effective long-term control. Sleep hygiene practices. For individuals struggling with insomnia, practicing good sleep hygiene can be an alternative or complementary approach. This includes maintaining a consistent sleep schedule, creating a sleep-friendly environment, avoiding stimulating activities before bed, and managing stress. Medications for alcohol withdrawal. In cases of alcohol withdrawal, other medications such as benzodiazepines like chlordiazepoxide or anticonvulsants like carbamazepine may be used as alternatives or in combination with diazepam. The choice of medication depends on the severity of symptoms and individual response. It is crucial to discuss alternative treatment options with a healthcare professional to determine the most appropriate course of action for your specific needs. They can provide personalized guidance based on your medical history, preferences, and treatment goals. How to take diazepam safely. To ensure the safe and effective use of diazepam, it is crucial to follow these guidelines. Follow prescribed dosage. Take diazepam exactly as prescribed by a healthcare professional. Do not modify the dosage or frequency without medical supervision. Avoid alcohol and other depressants. Avoid consuming alcohol or using other substances that depress the central nervous system while taking diazepam. Combining diazepam with these substances can increase the risk of side effects or overdose. Inform healthcare professionals. Inform all healthcare professionals involved in your care about your use of diazepam, including dentists, surgeons, and emergency medical personnel. Diazepam can interact with other medications and anesthesia, potentially causing adverse effects. Be aware of side effects. Be aware of the potential side effects of diazepam and take necessary precautions. Avoid activities that require mental alertness or physical coordination until the effects of diazepam are known. Do not stop abruptly. If you have been taking diazepam for a prolonged period, do not stop abruptly. Withdrawal symptoms can occur. Consult a healthcare professional for guidance on tapering off the medication. Store properly. Store diazepam in a cool, dry place, away from direct sunlight and out of reach of children. Follow any specific storage instructions provided by the healthcare professional or on the medication label. Following these guidelines can help ensure the safe and effective use of diazepam, minimizing potential risks and maximizing therapeutic benefits.